fly on the wall. You get to watch what we do. So tell us what your symptoms were before when you came in.
Okay, so I was progressively getting less and less balanced over about a 3-week period. Started with, quick dizzy spells, and then kind of grew into just a constant motion sickness, just really feeling uncomfortable and dizzy, having to lay down periodically. It was weird.
It was weird. And so when you say dizzy, were you spinning, or was like the room spinning, or did it feel like seasickness?
I felt when I felt dizzy, I felt like I was spinning.
Okay.
And then when it became more of I literally felt like I was on a boat and I was kind of swaying pretty much all the time.
Okay. So those are different types of dizzinesses,
Yeah.
if that's a word. And then the important thing was, why did it happen? You don't know. But
No.
I have a suspicion. So you were sick or something before.
I had been sick like maybe 6 weeks, probably 6 weeks before the symptoms started.
Okay.
And had gone through antibiotics.
Okay.
And I had a sinus infection.
So that's important.
That's how I was diagnosed. I was diagnosed with a sinus infection.
The sinus infection is bad.
Yes.
Yes.
And I took antibiotics, and the sinus infection went away, and I did still have some lingering ear pressure.
That's important.
But I had gone, it subsided for a while, and then it kind of came back. So, and went to the doctor and had my ears like cleaned out. That was one thing I had tried. I tried kind of like a device that is supposed to pop your ears.
Yeah.
That didn't help me. And then that was when, after that, about around that time was when I started to feel like my equilibrium was off. And
Right. So we worked on the hypothesis that it could have been a post-infection type of pressure inside. And so then what doctors did you see for all this before you came in?
Well, my doctor was out of town, and so I went and got some preliminary blood work done. And I have an appointment scheduled,
Good.
but I haven't been yet.
Okay.
And in the meantime, it was starting to get kind of debilitating, and so it occurred to me that you solved various problems for me over the years, and I feel like, you know what, I'm gonna go and see if in the meantime I can get some help. Yeah.
Okay. So what are the results now? We've only done 2 treatments.
Yeah.
We're going to do another one today in a second.
And
so
after the first day of the first treatment, I noticed that the motion sickness was really subsiding.
Yeah.
Still had a couple of dizzy spells here and there, but my biggest thing was the motion sickness. I mean, that was just the weirdest and difficult thing to deal with. And I really felt better the whole rest of the day. The next day, I had none of the motion sickness.
Okay.
And the dizzy spells I think maybe 1, possibly 2 that day, and I've been having them like up to 15 times a day, where just quick ones, but where you have to kind of catch yourself.
Okay.
So.
And you can't do your job, what is your job? This is the shameless plug. Are you aimed at us?
Yes.
Yes? Okay. What do you do?
I own 4 pet stores.
What's the website?
www.healthypetstores.com.
I'm going to put that on like the bottom.
Awesome.
Okay. And then where are the stores?
We have a location in Agora Hills, Thousand Oaks, Newbury Park, and Camarillo now.
Right across the street from us.
Yep.
So after a treatment,
that's where
I'm headed. Well, that's where you're headed, but that's where you should go headed.
Yeah, absolutely.
Go buy a chew toy or a squeaky toy.
Yeah, all the foods.
Yeah.
Good prices.
Even if you don't have a pet, just get a squeaky toy.
Just come check us out.
Who doesn't love a squeaky toy, right? Okay, so let's do this. Go ahead and actually sit right here. So what I'm going to do is I'm going to go right to the back of the occiput, right behind the ear, right there, and I'm just going to push through the muscle and see if I can feel any irritation to the upper cervical joint. So we worked on the hypothesis that it was just a post-infection and there was some pressure causing the equilibrium problems. And an adjustment to the upper cervical can help the lymphatic strain. And when she first came in, it was really tender.
Yeah, it's much better.
Right there, and I'm gonna say it's 70% better.
Yeah, that sounds about right.
If I can guess, and that feels much better. So then I'm gonna check the motion, and it's moving better, so that's really good. I'm gonna have it bend and just see. Now last time I adjusted your ear too.
That's true.
Did you have any drainage afterwards or anything weird?
Nothing particularly noticeable, but well, I shouldn't say that because I
Lie down on your
the fullness is gone.
The fullness is gone.
Yeah,
Okay.
so
Cool.
and I don't know if it was, I don't know, I felt like it was subsiding from the first treatment as
Or
well.
it's hard
so-
to know whether it's first
Yeah.
or second.
Right.
So the first thing I'm going to do is I'm going to use the laser, and what we're doing is we're just lasering the sinuses. We're going to do about 30 seconds each side here. So while I'm doing this, sell us on your stores. Why would I go there as opposed to any other store?
Well, we have a lot of incentives for coming to our store. We offer, well, first of all, we make sure that we keep our prices competitive. We try to stay well under the typical box stores that you might visit. We also offer frequent buyer cards, which is after a certain number purchased, usually between 10 or 12 bags of your dog food that you're already buying, you get a free bag.
Well, that's cool.
Yeah, so and we keep track of it. It's nothing you have to hang on to. So that's a huge incentive.
Why doesn't Thrifty do that for ice cream?
Oh yeah, that'd be nice.
But they
Yeah,
won't.
where
But
they
you
do.
do.
We do, right? We do at Healthy Pet, and we also have extremely knowledgeable staff. So any questions that you have diet related, the knowledge honestly that we have surpasses a lot of the knowledge that even your vet clinic may have. They're limited on their education in nutrition, and we have amazing foods. A lot of animals experience allergies and other possibly environmental issues going on with them, skin related, and those are problems we can solve. Also, if your animal, perhaps older, is experiencing joint pain, having trouble moving, we have glucosamine and chondroitin supplements that are fabulous, amazing products that really work. We have people come in all the time and give us feedback that they're amazing. I use them on my own dogs.
Gosh, I want to be a pet.
I know.
We'd all be healthier if we ate the food there as opposed to the stuff you get.
It's actually really true.
Okay, so what I did is I applied pressure on your sinuses on both sides, and usually when there's pressure you can feel it on each side, and I felt it each time you came in more on this side.
Right.
You felt more pressure there, and I could feel it too. So I'm going to use the arthrostem. It's getting better. So what I'm going to do is I'm going to just traction it here and apply this, and what you want to do is you want to breathe in through your nose. And let the air out. Okay. I'm just going to go straight down on this one. Breathe in. And let it out. And then breathe in. Breathe in. Okay. All right, so now I'm going to do an adjustment. I'm just going to support your. And then move your hair out of the way.
Oh, yeah, there we go.
Okay, now go ahead and sit up for me and face that way. So now I'm going to check it again and just see how it feels to me. Just going to push through the muscle.
And I'm really not feeling any pain at all.
Like you were
where it was
before.
terrible.
Yeah.
And even the second visit, I still felt it
Yeah.
very noticeable, and
My guess,
so much better right now.
yeah, my guess is 1 or 2 more treatments and this should be pretty much gone. And then we'll be all set.
All right.
So,
Like that.
you happy you came here?
Absolutely, always am.
I'm
Always am. I've referred so many people to you.
She has, and my brother just is gonna get a dog, so we're gonna be buying more toys. right,
Awesome.
and stuff. And for Christmas, what is he gonna get? Food.
All right, there you go.
First pet.
There you go.